Support for Arkansas Week provided by the Arkansas Democrat-Gazette, the Arkansas Times, and KUAR-FM 89.
And hello again, everyone, and thank you for joining us. The first confirmation of a new and especially dangerous strain of coronavirus was 2 years ago in Wuhan, China. It took 3 months for COVID-19 to travel the 7,645 air miles to Pine Bluff, where Arkansas's first case was diagnosed. It was close, but that patient survived. As of mid-December, though, some 9,000 of his fellow Arkansans have not been as fortunate. Almost 1 in 5 Arkansans, or about 600,000 of us, have been infected. Nearly 30,000 have required hospitalization, with 10% of them requiring mechanical assistance to simply breathe, and some of them for the last time. Came the vaccines, finally, and notwithstanding the political debates and the economic controversies, the numbers began to improve. But now the virus is surging again and worldwide. Time for us to examine where we are in Arkansas and where the experts believe we're headed. We're joined by Dr. Jose Romero, Secretary of the Arkansas Department of Health, Dr. Shane Speights, Dean of the College of Osteopathic Medicine at Arkansas State, and Dr. Kellee Farris, CEO of the Lee County Cooperative Clinic at Marianna. Dr. Romero, let's begin with you. What do we need to know at this point? As I mentioned earlier, the numbers were starting to look good, and now they're not necessarily back where they were, but the trend lines, some of them, are not encouraging.
Well, let me begin by thanking you for having me here. And yes, you're correct. We were on a downward trend. It appears now that we are starting to see more cases and more hospitalizations than we had previously. We continue to have significant numbers of deaths, and this will probably continue as we go forward. We are watching this very carefully, and we're concerned in part because of the Omicron variant that is being seen in a number of states, including 5 of the 6 contiguous states around us. And that means that the virus is here. We just have to identify it. So that we know that it's more transmissible, and it's possible that we'll see more cases and more hospitalizations in the upcoming weeks.
Before we go on that with Dr. Romero, let's go with some graphic information that I think your office has prepared for us. And the first one has to do with immunizations.
Yes, so the numbers speak for themselves. We 3.6 million doses and 1.8 million Arkansans have been vaccinated. For those individuals that are in the 5 and above age group that can receive the vaccine, we've administered to approximately 52%, a little bit more than 50% of the population are fully vaccinated. So we've been making headway in that area. We need to get higher. The national average is about 62%, 60%.
Okay, and also we've got some data information, record information now about where we stand in some key categories regarding the virus.
Yes, so as you can see, this is a comparison between last year around this time and the current numbers. And the new cases are down. We're seeing less cases, but I want to caveat that by saying that last year at this time we were on the upswing of a winter spike. So these numbers, while encouraging, may not reflect what's going to happen in the near future. So overall, you see that new cases are down, active cases are down, reported deaths, again, are about 1/3 of what we had last year, and current hospitalizations are about 1/2. So, and ventilator use is also lower than it was last year. But again, last year at this time, we were on the upswing of the winter surge.
Well, and there is this also, still about somewhere in the neighborhood of 1 in 5 ICU patients is a COVID patient, or am I correct there? About 20%.
I think that's correct. Most of the ICU beds right now are being occupied by non-COVID individuals. And that means that, if we have a surge in cases and we start to use those ICU beds, there may be if you will, a crunch to try to get those patients into ICU beds. It'll also impact those individuals that have other conditions that require ICU care. And their beds, beds for them will be more difficult to find.
All right, it's also, the data also seems to confirm, Doctor, that those who are requiring hospitalization. In fact, those who are sick tend to be overwhelmingly those who are not vaccinated.
That is correct. So individuals that have not received the vaccines are the ones that are becoming ill, being hospitalized, and our deaths are still made up primarily and almost exclusively of those individuals that have not been vaccinated or boosted. Because it's very important now that we all go ahead and move forward and get, in addition to our primary vaccinations, that we get our boosters as appropriate. And in particular, the older age groups, because we know that the antibody levels fell over time faster in that group than in other groups. And you're looking at the slides here, and you can see them. But overall, it's overwhelmingly those individuals that have not received a vaccine.
And we have a second follow-up slide anyway in terms of 5+, age 5 and over vaccinations, immunizations. There we are.
Right. So this shows our fully vaccinated individuals, so 52%, and then nearly 12% have received at least one dose. So the summation of those two is 63%. But remember, and more so now with the concern for Omicron, we want fully vaccinated individuals and fully vaccinated and boosted individuals as necessary in order to protect against severe disease from that variant.
Right. Dr. Speights, I assume it goes without saying that you don't believe, and I'm sure Dr. Romero concurs, that these immunization numbers are not what we would like to see, not what you would like to see.
Oh, not at all. We'd like to see a much higher rate of vaccination, certainly here in the state, and even somewhat across the country. One of the things, and Dr. Romero has already kind of hinted at this, the answer moving forward in terms of the Omicron variant is booster vaccines. And when we look across the country, only about a quarter of the populations actually had their booster vaccine, much lower number even here in Arkansas. And so with the rapid spread of the Omicron variant that we're seeing, and just you don't have to look any further than what's going on in the UK right now, it's happening actually daily. We're seeing doubling, or almost every 2 days, we're seeing doubling of the cases over there in the UK, specifically in the ages 19 to 28 or 29. The answer is booster vaccine, to be able to provide that level of immunity that you need to be able to prevent hospitalization and death.
Well, as Dr. Romero indicated a moment ago, the early evidence anyway, and correct me if I'm wrong, the early evidence suggests that the Omicron variant is not as vicious, as devastating anyway, as COVID could be, but there quite likely will be more of it.
I think we need to be cautious in terms of that data. There's actually a report just released yesterday by the UK in terms of their evaluation and the Omicron variant that they're seeing there in the surge of cases. And at this point, their data shows that they don't see a significant difference in terms of severity between Delta and Omicron. Now, that's cautionary. That's an initial report that came out, and we all know how sometimes initial data can be proven wrong, but we have to go with the data that we have in front of us. And that actually just came out yesterday. So I think we just need to be careful. The biggest thing is probably how it evades immunity right now in terms of the Omicron variant. And for those individuals that have been infected with COVID or the Delta variant or any of the other variants previously, you may not have the immune state that you really need to overcome not being severely infected by the Omicron. And again, just to underscore what Dr. Romero already said, the answer to that is vaccination, and specifically booster vaccines.
Kellee Farris, over there in the Delta and in other areas of Arkansas where the tend to be rural, low income, and to harbor many communities of color. It's been a continuing source of frustration to you and other health workers about the lower levels of immunization and effective measures to prevent infection. Are you making headway over there?
Unfortunately, it continues to be a big problem for us in the Delta, particularly. And we think about it on a racial aspect, but I believe poverty plays a big part in that issue. So 26% of our county live in poverty, and that's across racial lines. And so I think that's a big issue. That education is a big factor for us in this area, and people not understanding the severity of COVID, the need for the vaccine, and just having that inability to understand the way they should. And that socioeconomic status plays a big part in that.
Well, Dr. Farris, what do they tell you when you offer, you and your staff, when they offer immunization, inoculation, and they decline? What do they tell you? Why?
They tell us that the vaccine was created too quickly. They tell us they want to wait and see what happens to other people. Same thing with people with the booster shot. I hear it even from healthcare professionals that they do not want to get their booster dose. They want to wait and see, even after having their first and second dose. I've heard many misconceptions, but that biggest one is not believing the vaccine should be utilized so quickly.
And Dr. Speights and Dr. Romero both. We've been over this before, but I suppose it's worth going over again. It's often cited that the FDA approval for this is still conditional, correct?
So I'm not sure who should answer this, but these vaccines have been approved by the FDA for use in the age groups, and they have undergone scrutiny by the Food and Drug Administration and also by the CDC. And they continue to go through scrutiny. And so they're being watched very carefully to identify adverse events. They are safe overall. As you may know, yesterday, the Advisory Committee on Immunization Practices from the CDC made a recommendation that there be a preferential use of the mRNA vaccines. That is to say, to using the Pfizer and Moderna vaccines. And that is based on signals, safety signals that were identified. So I think the public needs to understand that these are extremely safe vaccines and that they're constantly being watched, and that these signals are triggering more in-depth evaluation of the vaccines, and then recommendations are made on top of that.
Yeah, and to Dr. Speights as well, there was some news coverage early Friday or Thursday night and Friday about the J&J version that individuals may prefer the two other options.
Yeah, absolutely, and I would certainly concur with that. I think the mRNA vaccines seem to be kind of the name of the game. We talk about COVID. Steve, I do want to kind of step back to one thing that Dr. Farris brought up that I think is a salient feature that is going to continue to be a part of the conversation even well after this pandemic, and it's really our education. And what I mean by that is we should make sure, even in the K-12 setting, that really, all graduates understand the importance of vaccination, the importance of, virus versus bacteria. I mean, a lot of these things that, to be honest with you, the three of us take for just take, for example, all the things that we learned in medical school, even before that. I mean, we take for granted that information because we deal with it every day. It's not common knowledge. And I think having these face-to-face conversations are sometimes difficult because of where the starting point is.
Well, go ahead. I'm sorry.
No, that was the point there. I think she's spot on in terms of how much we need to work for future pandemics in terms of vaccination and the importance of that. I think we've got some things we can do in the K-12 arena to help that.
From a clinical standpoint, all three of us, is this the new normal? Are we going to be in perpetuity looking for a new variant? And are we going to have to keep our own personal awareness, our own hygiene for that matter, at a higher level than we have been accustomed to in previous decades?
I'm optimistic that we come. Go ahead, Dr. Romero.
Go ahead.
Yeah.
No, please go ahead.
I'm optimistic that this is not the new normal, but that's just me. I want to be optimistic. I don't want to think about the fact that I have to continue to wear a mask in large groups. I have to limit where I go. I mean, I was kind of a hand washer anyway, so that's not anything new. But always worrying about that next variant. What are we going to see coming down the pike? I'm hopeful that we're not. And the early models were suggesting that we would hopefully be seeing the end of this pandemic, or somewhat of the end, here in the spring of 2022 and into the summer. And obviously the asterisk was, assuming we don't see a variant. And now here we are. It's just hard to tell. It's going to be a roll of the dice. And in terms of the variants that come after this, are they stronger? Are they hardier? Are they weaker? Is it something that becomes more of a common cold as opposed to increasing hospitalizations and deaths? I don't know. If anybody knows it, I'll say probably anybody. If anybody does know on this group, it's going to be Dr. Romero. So I'll be curious to hear his thoughts on that. But I'm going to take the optimistic road and hope that it's sooner or later we'll be out of this.
Well, Dr. Romero, your colleague just kicked it over to you.
Sure. Thank you. So, I think this virus is going to become endemic, meaning that it's going to be here for a long time in the future. which means that we're going to be seeing cases well into the coming years. Unfortunately, variants are going to arise, and they're going to continue to arise until we have a worldwide distribution of enough vaccines to tamp down this virus. So we can expect another variant sometime in the future. We have to be prepared for that, and we can use what we already know to combat that variant. I think that our approach to how we're going to deal with these viruses in a social environment will also change. I mean, I think the using a mask for some of us will be part of our normal attire as we go into the winter season when we start to see more of these respiratory viruses. So I think there will be a change. Do I think do I think a drastic dire change? No, but I think there will be a change, just like there has been in Asia, for example, or in the Pacific Rim, where masks are now considered standard use because of the SARS pandemic that occurred the SARS-1 pandemic that occurred earlier this century. So I think there's going to be changes. We're going to see more respiratory disease in the future, and there's going to be, I think, unfortunately, continued deaths due to this virus until we have sufficient numbers of individuals vaccinated against it.
Well, it may be the point here to kind of sidestep for a second to say that this is also, as both doctors, I think, pointed out, we are entering the seasonal flu season, not speaking specifically of COVID-19 or any of its variants, but I hesitate to say run-of-the-mill flus, but the seasonal variety that we see every year. So that raises the stakes, I should think, for each individual, as well as the clinical community. Dr. Speights?
Yeah, well, absolutely. As a matter of fact, even in my own clinic, I still see patients regularly. Saw flu and COVID in my own clinic. Typically, we're seeing flu A, which luckily right now, the flu vaccines that are out there protect against the strains that we're seeing circulating. And I hate to sound like a broken record, we go back to vaccination. We know vaccinations work. We know they reduce the incidence of hospitalization, severity, ICU stays, and death. And so I think vaccinations will continue to be part of the conversation in terms of allowing individuals to lead somewhat of a normal life. But one of the biggest concerns we're seeing now, and again, not try to kick it back too much to Dr. Romero, but what the data is showing is that we could be in a rough spot here in January, where we're seeing this surge of cases of Omicron, are already circulating Delta variant, as well as an increase in influenza cases. Those three kind of trifecta diseases together could seriously impact our hospitals and their ability to take care of people.
Well, let me go to Dr. Farris here, because you have in the Delta and other predominantly rural parts of Arkansas, you have a shortage of clinicians and in some cases facilities. So to use a base phrase, that's a double whammy you're looking at.
Absolutely a double whammy. And while we do have a shortage of clinicians and access, we have plenty of vaccines. We have plenty of tests. And so I want the people in our community and across the state to understand that the tests are available. The vaccines are available. There's no longer the need to wait 2 or 3 days for an appointment to get a vaccine, or 2 or 3 days for an appointment to get a test. You can get an at-home COVID test. And I had one of my staff joke yesterday that she's having a Christmas dinner at her home with her entire family coming to town. They're just so sick of not being able to get together. And she said, I'm just going to have to get a bunch of those at-home test kits and hand them out at the door. She was joking, but it's a thought. It's a thought. And come January, I am afraid to see what happens after this holiday season.
Dr. Romero, following up on Dr. Farris there, and I think Dr. Speights alluded to this a second earlier. A year ago, the system was in danger of just simply crashing. All the metropolitan hospitals, or every hospital across the state, was jammed to the rafters. Staff couldn't get any sleep. Is it possible that we could see attain that level again of stress?
Unfortunately, yes, it is. It's very possible. If we start to see an increase in the number of the Omicron cases, although it may have milder disease overall, you're still going to have more individuals that are infected, and some of those individuals are going to progress to hospitalizations. If we have a surge in influenza cases, that will compound the issue and could bring us to the point where we overwhelm the system. We have come very close on 2 occasions, the winter surge and the summer surge, in overwhelming the bed supply and the bed supply here in the state. And I'm concerned that we could again approach this, or this time actually overwhelm the system. The other thing I want to do is focus on the pediatric population, because we have vaccines now available for that group 11 to 18. That is the pediatric and adolescent group. We have a single pediatric hospital in this state, which is a blessing and at the same time a disadvantage. There are only so many hospital beds available for children. If we start to have more cases of children that have either flu or influenza, flu or COVID, which are vaccine preventable at this time, the hospital capacity could be overwhelmed. So again, I want to encourage parents to consider seriously vaccinating their children. It is important both for flu, influenza, and for the COVID vaccine. These are safe vaccines, they're effective, they prevent infection, they prevent death.
It has to be frustrating to clinicians, practitioners of every discipline, that particularly epidemiologists, that the one best way to halt a pandemic is to immunize as many people as quickly as possible. And yet there remains enormous cultural and political resistance to immunization. Dr. Speights, you've alluded to this before. It's got to drive you up the wall.
It's beyond frustrating. It really is. When we talk about that's almost its own separate pandemic, is the amount of misinformation that is spread rapidly through social media and over the internet that truly is affecting people's decision making. I mean, I was on the phone just the other night with a patient of mine, and their child had been infected. I've been working with them for a long time to try to get the person vaccinated, and they didn't want to because of all the different misinformation they were reading. Back to what Dr. Romero said, these vaccines are safe and effective. Billions of doses have been given worldwide on these vaccines, and they're safe and effective. And this is the way to prevent severe disease, hospitalization, and death. And so it kind of blows my mind that we're still this far into it, and now looking down the barrel of another variant that could overwhelm us, that we're still really having these debates and these conversations. And it all boils down to the spread of misinformation. There's a lot of psychology behind it. There's a lot of fatigue. Dr. Farris, kind of alluded to that in terms of her colleague that's going to have family over for Christmas. I mean, I think that's a lot of households, not only in Arkansas, but certainly across the country, that are just so tired of this and they just want it to be over. But it's not, and the disease doesn't care. As my oldest son always reminds me, facts don't care about your feelings.
Dr. Romero, I have to say, you and other physicians in positions of public responsibility at the university level and in government, some of this, frankly, vitriol is aimed directly at you. How are you bearing up? How do you deal with it?
Well, I think those of us that are in positions like this understand that we are going to be the target of a lot of frustration, a lot of dissatisfaction with the current situation. I look at it as something that it comes with this position, that as long as I am following the science, following good policy, and out for the health and welfare of our citizens, it's tolerable, and I accept it. But I believe that our decisions have been scientifically based, have been policy based, and are for the good of the population. We are always willing to modify as necessary, but to date, our decisions have been for the best for the public.
Dr. Kellee Farris, we've got family. It's the Christmas season. Within days, we've got all families gathering, close proximity to one another. It's a great season. Does it necessarily need to be a dangerous season? Dr. Farris.
It does not need to be dangerous. We can still enjoy our families. We can still be cautious. We can, if you know you have symptoms of flu or COVID, don't take that chance of coming around your other family members and you're symptomatic. We can still get together with our families and wear our masks, wash our hands. Just be careful, be cautious, be cognizant of what we have been through these last 2 years. Everyone is tired of it, but we can do our part to, even outside of being vaccinated, which is the number one thing that could help us right now. But if you're not going to be vaccinated, at least be safe in other ways.
Dr. Speights, I can't imagine you'd argue with any of that.
Oh, not at all. And I want to reiterate something that Dr. Romero mentioned, and I know Dr. Farris alluded to it as well. You've got, for all three of us, I'll speak for all three of us, we make the best decisions we can based on the best available evidence at the time. And you're taught that as a physician. That's what goes through your training. So if the patient's sitting in front of you, you want to make the best decision for their health and for their welfare based on the information you have at the time you make that decision. And I can speak for all three of us that we're doing the exact same thing for our community, for our state, and for our regions whenever we provide that information regarding COVID, vaccination, how to keep your family safe, how to keep yourself safe. But I'll go back to what you already asked earlier. There's certainly a lot of frustration on our part as we continue to try to do that. To be honest with you, individuals not qualified to make those comments, trying to really undo what we're doing.
Got to end it there because we're out of time. Dr. Romero, Dr. Speights, Dr. Farris, all three of you, thank you very much for your time. Thank you for coming on, and we'll see you in the new year. Be safe. Thank you for joining us as always. Next time.
Support for Arkansas Week provided by the Arkansas Democrat-Gazette, the Arkansas Times, and KUAR-FM 89.